My disease was on asthma. What is asthma? It is a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. Asthma can be treated by a medical professional. It requires a medical diagnosis, and lab tests or imaging can be required, and it can last for years or it can be lifelong. Asthma is very common. It doesn't matter what age you are, you can you can't really get it, but yeah, you can have an asthma attack. Babies, toddlers, children, teenagers, young adults, adult seniors, but it's mostly common in like children and teenagers. And there's also, yeah, it's very common. It's more than 3 million cases in the US per year. How asthma symptoms occur. Asthma symptoms happen when the covering of your airways swell and the muscles around them tighten. Bodily fluid at that point fills the airways and it makes it hard for air to get through. And when that happens, this is what you call an asthma attack. And then your chest starts to tighten. And that's very common. Consequences of asthma. People with severe asthma also have an increased risk for respiratory failure. Respiratory failure happens when not enough oxygen travels from your lungs to your blood. Life-threatening asthma is very rare, but it tends to cause symptoms that get worse over time. Some common symptoms of asthma is a cough. It can occur at night, exercise. It can be chronic and dry, or you could spit up stuff, or you might not. Of course, your breathing will be a symptom. You difficulty breathing, you might hear some wheezing, or you might see somebody breathing through their mouth, and they might be breathing very fast because they can't get enough air. Chest pressure is also common. Anxiety, fast heart rate, and throat irritation. How you could prevent an asthma attack from happening? If you have asthma, you need to know what your triggers are and what would cause you to have an attack, so you could stay away from it. Yeah, also stay away from any allergies you may have. You have to avoid smoke of any type. Try to not get sick. You can allergy proof your home. Like with pets, some people aren't allowed to have pets because it will cause their allergies to act up and it can cause them to have an asthma attack. Make sure you're getting your vaccinations. You can consider getting allergy shots, and if you have any asthma medications that are prescribed to you by your doctor, then you should take them. Treatment. Asthma can be managed with an inhaler, which most people have. Whenever they have an asthma attack, they might just pull out their inhaler. Some severe cases may require a longer acting inhaler that keeps the airways open, as well as oral steroids. Self care can also help treat asthma. So, like, an example would be smoking. So, if you smoke, then you should stop smoking because that's not good for you. Some fun facts about asthma: not everyone will have the same symptoms. Um, Asthma is not a contagious or a communicable disease. So you can't cough on anybody, or if somebody has asthma and they cough on you, you don't have to be worried about getting it because it's not that type of disease. 8.3% of Americans have asthma, and particles of cockroach waste can actually trigger an asthma attack.